Good morning. My name is Abdullah Bazazo. I am a second year student in the Master of Medical Studies program at Northam University, working under the supervision of Dr. David Marsh and Dr. Christine Morin. Today I will be presenting our study titled The Effect of Homelessness on Opioid Agonist Treatment Retention Among Patients with Opioid Use Disorder, a retrospective cohort study. I have no relationship with for-profit or not-for-profit organization to disclose, and this session has not received any financial or in-kind support. Beginning with the introduction, opioid-related deaths in Ontario have increased by approximately 200% between 2016 and 2023. Homelessness significantly worsens outcome for individuals with opioid use disorder, leading to elevated rates of overdose and mortality. While opioid agonist therapy is known to reduce these risks, factors such as housing instability and limited access to health care, particularly in rural and northern Ontario, can negatively affect treatment retentions. These disparities highlight the urgent need for targeted interventions tailored to vulnerable populations. Based on what I discussed in the introduction, we can formulate our objective as examine demographic characteristics and health care services utilization among individuals with opioid use disorder and opioid agonist therapy, comparing those with a history of homelessness to those who have always been housed. To achieve our objective, we followed this methodology. We conducted a retrospective cohort study using ICES administrative data from January 1st, 2014 to December 31st, 2022. Our population is adults aged 18 and older in Ontario, diagnosed with opioid use disorder, and prescribed either methadone or buprenorphine naloxone. Exposure: ever experiencing homelessness versus never. Our coverages are age, sex, income quintile, geography, northern versus southern, rural versus urban, HIV status, hepatitis C status, mental illness, and person years in treatment. For statistical analysis, we used chi-square test for categorical variable and Mantel-Hansel method for continuous variable to assess statistical significance between groups. We found out that compared to those who were housed, individuals with a history of homelessness were younger on average, more likely to fall into the lowest income quintile, more commonly resided in urban areas, slightly more likely to be treated with buprenorphine, had higher rate of HIV infection, had significantly more frequently emergency department visit, and had higher rates of hospitalization. These findings underscore the importance of developing targeted intervention to address the distinct health and social challenges faced by people experiencing homelessness. Improving healthcare access, especially in urban centers, and tailoring treatment strategy may help reduce disparities and improve outcomes. Ongoing research is essential to further understand these differences and to inform policies aimed at supporting the well-being of this highly vulnerable population. Thank you.